A very good morning to all of you. This is Dr. Neelesh Singh, working as a reader in the Department of Periodontology, BBD College of Dental Sciences. Today I am going to take a lecture on immunity and inflammation, basic concepts, part 1. Now, what question should come in the mind of reader that what is the difference between immunity and inflammation? Basically, or in simple terms, immunity is the vast system and inflammation is the response of immunity. In periodontology, we have two main diseases, gingivitis and periodontitis. Both are inflammatory in nature. Now, from 8th standard, we are learning that immunity is of two types, the innate immunity and the adaptive immunity. The innate immunity is basically the default immunity. It refers to the non-specific defense mechanisms that act as barriers to infection. The main components are barriers like skin, mucosa, acidic pH, etc. Antimicrobial molecules such as lysozymes, antimicrobial peptides, immune system cells, mainly neutrophils and macrophages, which kill by phagocytosis, receptors like toll-like receptors that recognize pathogen-derived molecules and activate immune responses which are inflammatory in nature. Now, antigen presentation to activate the adaptive immunity. Now, this antigen presentation is mainly done by the antigen presenting cells, and the major part which is played by the dendritic cells. Adaptive immunity. It refers to the antigen-specific immune responses. The components are the recognition of specific molecules on infective organisms at species and strain level, cellular responses and humoral responses. Now, cellular responses are responsible for the intracellular pathogens, and humoral response is mainly for the extracellular pathogens like bacteria. Now, this involves B cells and plasma cells which produce antibodies. Now, cellular responses mainly include the T cells. Now, it is very clear that innate and adaptive immunity do not function in isolation. Close integration exists between innate and adaptive arms of the immune responses. Now, what is inflammation? This definition is taken from the Robbins Pathologic Basis of Disease 7th edition. It is the textbook of general pathology. It is the local response of living mammalian tissues to an insult due to any agent. It is a body's defense reaction in order to eliminate or limit the spread of infectious or harming agent. There are four cardinal signs of the inflammation. First is heat, redness, swelling, and pain. These four signs were given by the Cornelius Celsius in 1st century, and the fifth one was given by Rudolf Virchow, and that is loss of function. Now, stages of inflammation basically on the basis of time is immediate inflammation, acute, and chronic inflammation. What is immediate inflammation? Immediate inflammation is basically set by the leukocytes at the site of insult, that is the resident leukocytes, dendritic cells, mast cells, and monocytes. It occurs within seconds and minutes. If immediate inflammation proceeds, it causes acute inflammation, mainly sets in by the PMNs from the blood vessels. It occurs within minutes and several hours. If the problem does not resolve, chronic inflammation sets in, which is mainly T cells and B cells responsible for it, and macrophages. This symbol is of macrophage. Now, chronic inflammation is a potentially never-ending process if it is not treated. Now, what is this? It is the cells of immune system, the sources of cells. Basically, there are three parts in this diagram: bone marrow, blood, and tissue. The bone marrow contains multipotent stem cells. They can be converted into two types of lineages: lymphoid stem cells and myeloid stem cells. Now, lineages, type of cells. Now, lymphoid stem cells can converted into NK cells, pre-T cells, T cells, B cells. Now, these pre-T cells are formed in blood. It is converted to T cell in thymus, and from thymus again T cell comes into the blood, and when any infection comes in, T cells are transferred to lymph nodes where they are converted into activated T cells. Now, these B cells are formed in the blood and they are converted into plasma cells in the lymph nodes. So, lymph nodes can be considered as a maturation organ for the T cells and the B cells. Now, multipotent stem cells can be converted into myeloid stem cells. This myeloid stem cell can they get converted into mast cell progenitor, basophil, eosinophils, neutrophils, monocytes, peripheral dendritic cells in the blood. Now, they can also get converted into megakaryocytes in the bone marrow, which converts to platelet in the blood. Myeloid stem cell convert directly into RBCs in the blood. The mast cell progenitor converts into mast cells in tissues. Neutrophils get converted into microphages in tissues. Monocytes convert into macrophages in the tissues. So basically this diagram is the summary of sources of the cells of immune system. Now what is this? This is basically a table having these immune cells. We have to remember the normal levels of these cells and mainly the functions of these cells. For example, neutrophils and monocytes, they function for as the phagocytes, eosinophils and basophils in parasitic activity. Then these are the lymphoid cells, CD4 positive, CD8 positive cells, B cells and NK cells. NK cells are mainly involved in killing of the virus cells and the tumor cells. Now this diagram presents the basic structure of inflammatory process. Now this is a microbe. It enters in the body, activates the complement system, the C3A. This activates the mast cells. This further produce or activates these components, and this component act on the endothelium of the blood vessel. What happens is there is a release of P selectins and which results in the transendothelial migration of neutrophils, and they come out into the tissues and perform phagocytosis of the microbes. Now if phagocytosis does not occur or the inflammation or infection doesn't resolve, then what happens is the chronic inflammatory process sets in. The lymphocytes and monocytes convert into the they convert into the phagocytic cells. For example, B cells get converted into the plasma cells and they produce antibodies and destroy the antigens or the microbes. So basically this is the gist of inflammatory process. The details will be in the next chapter or remaining part of this chapter. So if anybody have doubt, they can post on the video comments. Thank you all.